Staging of mesothelioma is based on the recommendation by the International Mesothelioma Interest Group. T&M classification of the primary tumor, lymphoid involvement, and distant metastasis is performed. Mesothelioma is staged IV4. Mesothelioma is staged 1A to 4 based on the T&M status. The prevention of mesothelioma includes: mesothelioma can be prevented in most cases by preventing exposure to asbestos. The recommendation of exposure limit of asbestos is 0.1 fiber per cubic meter. Diagnosis may also include screening. There is no universally agreed protocol for screening people who have been exposed to asbestos. Screening test might diagnose mesothelioma earlier than conventional methods, thus improving the survival prospects for patients. The serum osteopontin level might be useful in screening asbestos-exposed people for mesothelioma. The level of soluble mesothelin-related protein is elevated in the serum of about 75% of patients at diagnosis, and it has been suggested that it may be useful for screening. For treatment purposes, mesothelioma is generally resistant to radiation and chemotherapy treatment. Long-term survival and cures are exceedingly rare. Treatment of malignant mesothelioma at earlier stages has a better prognosis. Clinical behavior of the malignancy is affected by several factors, including the continuous mesothelial surface of the pleural cavity, which favors local metastasis via exfoliated cells. Invasion to underlying tissue and other organs within the pleural cavity, and the extremely long latency period between asbestos exposure and development of the disease. The histological subtype and the patient's age and health status also help predict prognosis. The epithelioid histology responds better to treatment and has a survival advantage of sarcomatoid histology. The effectiveness of radiotherapy compared to chemotherapy or surgery for malignant pleural mesothelioma is not known. Treatment by surgery by itself has proved disappointing. In one large series, the median survival with surgery was only 11 months. A pleurectomy decortication is the most common surgery for mesothelioma cancer, in which the lining of the chest is removed. Less common is an extrapleural pneumonectomy (EPP), in which the lung, lining of the inside of the chest, the hemidiaphragm, and the pericardium are removed.